When you visit Mosi-oa-tunya, there is a shower. You receive a very inspirational shower. Never use an umbrella, you won't receive this inspiration. Allow the spray to spray on you. It is my singular honor and privilege to welcome you all to Zimbabwe for this important event leading up to the commemoration of the 30th anniversary of the International Conference on Population and Development. At the onset, may I thank the partners in population and development and the United Nations Population Fund for selecting Zimbabwe to be the host of this historic conference. Please feel at home away from your respective homes. During your stay, I invite you to visit the majestic Victoria Falls, Mosi-oa-tunya. But I must explain a bit about this one. There was a gentleman sometimes back whose name was David Livingstone from the United Kingdom, who visited this country. And our people in this area are very nice people. So they wanted to show this gentleman this wonder. So Dr. Livingstone was brought to see our Mosi-oa-tunya. But where he came from, that was the United Kingdom, there was a queen called Queen Victoria. So instead of carrying the name he was told by our people, he decided to name our own Mosi-oa-tunya the name of the queen where he had come from, and made it Victoria Falls. So may I ask you, delegates, come and visit Mosi-oa-tunya. As we gather to take stock and reflect on this important subject before us, I'm pleased to highlight that over the years, the government of Zimbabwe has made significant strides in implementing the goals of the International Conference on Population and Development. No, I should go back to what I left out. When you visit Mosi-oa-tunya, there is a shower. You receive a very inspirational shower. Never use an umbrella, you won't receive this inspiration. Allow the spray to spray on you. To date, the total population of Zimbabwe has doubled from 7.6 million in 1982 to 15 million in 2022. This increase in the population growth rate is attributable to an overly improved quality of life of our people. Additionally, the decline in HIV and AIDS-related mortality rates owing to the increased availability of antiretroviral treatment, as well as reduced mother-to-child HIV transmission, has had positive impacts on our population. Similarly, fertility rate has steadily declined. While life expectancy at birth has increased due to comprehensive and coordinated socioeconomic and healthcare interventions by government, it is notable that our sisters have a higher life expectancy compared to their brothers, ourselves. While life expectancy has risen to 65 as a population, Zimbabwe's natural maternal mortality ratio is on a decreasing trend from 651 per 100,000 live births in 2015 to 362 per 100,000 live births in 2022. The multi-pronged and people-centered National Development Agenda has registered progress on the social development front. Consequently, Zimbabwe has improved in the Human Development Index rankings worldwide. My administration is scaling up the implementation and promotion of sustainable economic growth, employment and wealth creation towards accelerating national development, modernization and industrialization. We are determined to lift many more of our people out of poverty into a higher quality of life. Guided by our national vision and the national development strategy, our country is on course to achieve an upper middle income society by 2030, while also addressing the continental and the global aspirations under the Sustainable Development Goals and Africa Agenda 2063, respectively. Our robust policies have resulted in the sustained, inclusive, and equitable GDP growth, promotion of new enterprise development, employment and job creation, as well as robust climate change mitigation and adaptation programs, which we have introduced. Increased investment in health, water, sanitation, education, energy, roads, housing, and other social amenities are impacting on the quality of life of our people. Additionally, existing social safety nets, such as the public health and education assistance, drought relief, public works and input support schemes for vulnerable families, smallholder and communal farmers are being continuously broadened. The introduction and the wide adoption of Mosi-oa-tunya climate-proofed agriculture program. I must explain what this Mosi-oa-tunya is. We have something like 3 million households, rural households. So as a government, we provide each season with inputs for each family of household. So they have something from government to plant seed as well as fertilizer. That guarantees food at the household level. That's a government program. That's among other comprehensive policy initiatives which has seen our country realize national food and nutrition security. Leveraging on the increased access to quality and affordable education, our country is ensuring that high literacy rates translate to an enhanced quality of life of our people and the economy as a whole. Further, the introduction of Heritage-Based Education 5.0 model is fast transforming, industrializing and modernizing our economy. I must explain that one. Since the Second Republic, we have introduced innovation hubs at all our state universities, and the government funds those innovation hubs. Then we ask our girls and boys at these institutions of higher learning to dream those who have talent, and they translate their dreams into either a service or a product. Even if they fail, we don't discourage them from dreaming. Our youth and learners are now equipped to produce goods and services. Ladies and gentlemen, on gender equality and women empowerment, Zimbabwe is dedicated to achievement of gender equality and the empowerment of women. The National Constitution of the Republic of Zimbabwe specifically prohibits discrimination based on gender and outlaws all forms of gender-based violence. My government has made bold decisions to ensure the inclusion of women in Parliament, Cabinet, local authorities, as well as other decision-making entities across national institutions. Lessons from the outbreak of the COVID-19 pandemic reinforce the importance of the requisite social safety nets to protect women owned business as well as micro and small medium enterprises from external shocks that may lead to the loss of lives and livelihoods. It is equally important to adopt effective pathways for the holistic development and empowerment of youth. Zimbabwe is a youthful nation where 67.7% of the population is below the age of 35. Hence, my government is ensuring that the youth play a pivotal role in the national development agenda of the country. To date, youth enjoy a parliamentary quota, with a notable number having been appointed into cabinet and within other strategic national institutions. At a policy level, the National Youth Policy provides a framework for creating an enabling environment for stakeholders to implement youth development and empowerment programs in a coordinated manner. Education and skills development are indispensable for the sustainability of youth participation in the economy and governance sphere. As such, we continue to invest in vocational training centers and skills development programs, which equip trainees with entrepreneurial skills for any developing nation. Meanwhile, age-responsive information on reproductive health continues to be availed to the youth and adolescents. The criminalization of early and forced child marriages and other harmful practices is facilitating the safe transition of children into adulthood. Distinguished ladies and gentlemen, in a bid to track our commitments to the International Conference on Population and Development, my government established a multi-sectoral national task force which periodically meets to coordinate, monitor, and evaluate the implementation of the program of action. The task force employs a whole of government and a whole of society approach. Similarly, we call for seamless coordination to scale up South-South and triangular cooperation. I'm pleased to highlight that through such partnerships, Zimbabwe has managed to fill gaps in health service provision. This has seen medical and other health specialists coming to our country to assist us in the health service delivery sector from as far afield as the People's Republic of China and Cuba. Periodic fellowships and capacity building programs offered by partners in population development have also resulted in members of our health workforce attaining specialized postgraduate qualifications. In this regard, we remain grateful to partner countries such as the Republic of Egypt, India, South Africa, for providing these scholarships to us. Exchange programs with other member countries of the partners in population development are equally appreciated. Internally, my government has increased the number of fully fledged medical schools for the training of doctors and specialized health personnel towards increased patient-to-doctor ratio as well as availing specialized health care to grassroots communities. Ladies and gentlemen, Zimbabwe remains committed to universal health coverage. Remarkable progress has been made towards improving availability and accessibility of reproductive, maternal, newborn child, and adolescent health services at all levels of our society. Following the outbreak of COVID-19, the government of Zimbabwe successfully mobilized the procurement of COVID-19 vaccines and rolled out robust national vaccination programs. I remember that when we were targeted by COVID-19, as my minister said, we could hear murmurs from corridors of power that Zimbabwe is going to suffer a lot. And indeed, when we wanted to access this medical oxygen, I don't know, there's another name, for patients. So that medical oxygen, when we wanted to access it, we were told Zimbabwe is ABC on the alphabet, we're at the bottom. We always put at the bottom. So we put a team of our own scientists. We now produce medical oxygen in Zimbabwe. And I'm told the purity level of the world oxygen purity is about 96%. But ours is 99.2% purity, which we produce. And we overproduce it, so we can always, in fact, we're giving to some of our neighbors freely as comrades. This has resulted in the domestic funding for family planning rising within the national health budget from 1.7% in 2023 to 2.4% by 2022. Our national health budget allocation was at 14.9% in 2022, in line with the 15% aspiration outlined in the Abuja Declaration. So we are very close. We are at 14.9%, but the Abuja Declaration requires us to reach 15%. The overall effectiveness of the Zimbabwe National Family Planning Council has made overall positive ripple effects on our family planning and the reproductive health services. In spite of these success milestones, Zimbabwe faces challenges in the health sector that we believe can be tackled through South-South triangular cooperation. The most pronounced problem being the continued albatross of the illegal sanctions imposed on our country by some Western countries because we claimed our land. We don't regret. If history repeats itself, we will still claim our land and they can still put their sanctions. Meanwhile, our government's investment in the training of doctors, nurses, laboratory scientists, and radiographers is being negatively affected by the attrition of health workers due to increased immigration to developed countries. It is therefore important for us, through the South-South and triangular cooperation, to interrogate this phenomenon, share ideas and learn from each other towards addressing the push and pull factors in this sector. In the same vein, collaborative multi-country research and development is essential to promote local capacities with regards to the manufacture of drugs and the related commodities that better meet the needs of our respective populations in the region. In Zimbabwe, innovation hubs and industrial parks within our universities have been developed and are viable startups such as those in the production of medical oxygen, ultrasound gel, and other medical devices, gadgets, and consumables. Distinguished guests, ladies and gentlemen, as I conclude, may I reiterate the need to scale up the provision of maternal health and reduction of child mortality as a vital aspect of the attainment of sustainable development of the developing countries. The mantra, "no woman should die whilst giving birth," remains our guiding motto in Zimbabwe. Further, let us consolidate our engagement and partnerships with the South-South and Triangular Cooperation Framework to unlock more resources for our respective national development plans towards a prosperous and a healthy life for all our citizens. Domestic financing and innovative interventions that promote gender equality and the empowerment of girls and women remains critical. As I said at the beginning, my statement, the Second Republic is doing its best to catch up with South Africa in the empowerment of empowering women. I asked my dear brother how he feels to be dominated. My brother said he enjoys it. Ultimately, the burden and responsibility to realize development that leaves no one behind and no place behind within our respective countries is a collective responsibility. Collectively, as developing countries, we must deliver. With these remarks, it is now my pleasure to declare this 20th International Inter-Ministerial Conference on the South-South and Triangular Cooperation on Population and Development officially opened. I wish you all fruitful deliberations and a memorable stay in Zimbabwe and in particular Victoria Falls. God bless you all. Thank you.